Hi Ashley, how you doing?
I'm doing good.
Well, thank you. Thank you for coming, first of all. And I really appreciate you giving me the opportunity to work with you and trusting me. Before we start, I would like to let you know that everything that we talk in this room is confidential, but there are some limits. Some of the limits of confidentiality is that if I know or you let me know that for some reason you are at risk of someone in the house, then I have to break the limits of confidentiality. And that also includes like if you're suicidal or somebody within your house is at risk. So thank you for all. So before we start, Ashley, I would like to ask you some questions before we start the sessions. So Ashley, can you give me your last name?
Ashley. Ashley Roster.
Okay, thank you. So Ashley, how old are you?
I'm 17.
All right, thank you. So let me know if this is your address. I have you in 1774 Firestone Drive in Tulare. Okay. Okay, I have your email as well. Let's see. Would you like to give me more information in regards to are you married? Are you currently married? Are you single?
Oh, I'm single.
You're single. Are you currently dating?
Yeah.
Okay, dating. For how long have you been dating?
2 months.
2 months. So Ashley, are you currently going to school?
I am.
Yeah. What is the name of your high school?
Western.
Western. What grade are you in?
11th.
Grade 11. How are your grades?
I am a straight A student.
Oh, congratulations. Super. So, can you give me a little bit more information in regards to who lives in the same house where you live in?
My mom and 2 brothers.
Mom and 2 brothers.
And my father isn't there.
Your dad is not in the picture. Okay. How old were you when your dad left?
I was about 6.
You were 6 years old when. Okay, 6 years old. And how old are your brothers?
One's 9 and one is 11.
11 years old. So you're the oldest, right? Okay. Okay. In your own words, can you describe me what would be the current problem that you have?
I get really anxious when I'm around a lot of people or just people in general, and I start to like stutter and my hands get sweaty and
Okay, hold on. So you get anxious when you're around people. You said that your hands get very sweaty.
yeah.
What else?
I get really nervous and I
Nervous.
stutter my words
Mm-hmm.
and I don't know, I just try to avoid situations where I have to speak to people.
No, you like to avoid situations. Okay. Any other symptoms?
Not that I could think of.
Mm-hmm. How long have this been going on?
As soon as I started high school.
As soon as you started high school. Okay, so we're talking about when you were like around 12?
I say
14, 14 years old. So what made you come this time if you have been experiencing this for 2 years?
I don't know. I've just noticed it like kind of got out of hand and
It got out of hand.
yeah.
What do you mean by it got out of hand?
My symptoms started to occur a lot frequently and
More frequently, is how often? By frequently, what do you mean how often?
like every time I speak to a new person or have a presentation or even sometimes my friends.
Okay. Would you want to say that this happen once, twice a day, or weekly?
It happens like twice a day or even more
Twice a day
sometimes.
or more. Okay. Thank you. Thank you for sharing that with me, Ashley. So tell me, what do you hope to gain from this evaluation or from participating in therapy?
What I'm hoping for is to like show less symptoms and try
Show less symptoms?
yes and try
Well,
to like get rid of maybe what's happening to me.
and get rid of what is happening to you.
Yes.
What would you describe what is happening to you?
I would think it's social anxiety or
Getting rid of your social anxiety, is that what you would think it is?
yeah.
Okay. Um, Going back to the symptoms that you have experienced, tell me what difficulties have you experienced in the past and what have you done to overcome the symptoms?
Well, in the past they weren't as bad, but I would like take like a deep breath and
Take a
exhale.
deep breath. That's excellent. Good job. Deep breath and what else?
Or sometimes I'll just fidget with something and just try to calm myself.
Hmm. You said that you also count 1 to
Yeah,
10.
I
Yeah,
also
is that what
count.
you said? Okay. Out of these three things that you have said, which one is more effective?
I say the breathing technique.
The breathing technique. So I'm gonna describe some symptoms, and you'll let me know whether you can just say yes or not. Okay. Do you experience difficulty falling asleep?
Sometimes.
Difficulty getting out of bed?
Yeah.
Any persistent loss of interest in previous enjoyed activities?
No.
Withdraw from other people?
Yes.
You do. How about some depressed mood?
No.
Rapid mood changes?
Sometimes.
Sometimes. Anxiety?
Yes.
Frequent feelings of guilt?
Yes.
Difficulty leaving your home?
Yes.
Good, thank you. How about some outbursts of anger?
No.
Mm-hmm. How about feeling
No.
no, panic attacks?
Yeah.
Yeah, wow. Tell me more about your panic attacks. When is the last time that you have an episode?
I say the last time I had a panic attack was whenever I had a school presentation.
A school presentation. Okay. How many times have this happened?
It's been happening quite often, but the last time I can recall was like 3 days ago whenever I was in class.
Thank you. Thank you for sharing that. I really appreciate. Any feelings of feeling worthless,
No.
sadness,
No.
fear,
Fear, yeah.
fear? When you say fear, what do you mean? Like, what is it that you fear of?
I fear that other people will judge me if like I say the wrong thing.
Mm-hmm. Any changes in your appetite? Have you been eating more than often or less of?
No.
Difficulty catching your breath?
Yeah.
Um, you mentioned sweatings, right? Increase in energy,
No.
tremor,
Sometimes.
frequent worry.
Yeah.
How about racing thoughts?
Yes, definitely.
How about feeling dizzy or decrease in energy?
No.
Yeah, thank you, Ashley. Thank you. Really appreciate that. I have some other questions that I would like to ask you as we proceed through our therapy sessions. Okay, but meanwhile, let me ask you some other questions. Uh, you might choose to not answer, but I have to ask those questions, and it is in regards to sexual orientation. Are you bisexual?
I'm not.
Homosexual?
No.
Heterosexual?
Yes.
Have you ever seen a counselor or psychologist or psychiatrist in the past?
I've talked to a counselor once, but
What happened?
not much. I just talked about how I get nervous, but they didn't do much.
They didn't do much. Okay, thank you for sharing. And was this a therapist in a private? Was that in your school or where
It was in my school.
In your school. Can I have her name?
Miss Mackenzie.
And you said that it was because you also were having some nervousness. Okay. When was this? Can you give me a date?
It was, I can't exactly recall, but it was like 2 weeks ago.
Okay, 2 weeks ago. Okay. Was that the only one time that you have seen someone on especially mental health? Okay. Are you currently taking any medication?
I'm not.
Okay, thank you. Have you ever been hospitalized due to for psychiatric reasons?
No.
Have you ever attempted to commit suicide?
No.
Are you currently under treatment for any medical condition?
No.
Okay, any illness?
No.
About some history about your family. Is your what is your dad's age?
He's 43.
Is he living? Is he still alive? Or is he deceased or dead?
He's still alive.
Okay, thank you. What is his occupation?
I'm not sure. I haven't talked to my dad in a while.
All right, thank you for sharing that. How about your mother? How old is she?
She's 34.
Is she still living?
Yes.
Of course, you say that you're living with her.
Yeah.
Right? Thank you. What is her occupation?
She works at a school, and she's kind of like a teacher, but an aide.
Okay, teacher aide. Okay, so you mentioned about your brothers. I do have that information from there. During your childhood, do you live any significant period at a time with anyone other than your natural family? Like probably like someone was taking care of you while your parents were working, or were you living with grandpas?
For like 2 months, I stayed with my grandpa.
You stayed with grandpa for 2 months. 2 months with grandpa. Okay, so you say grandpa. Can you say grandpa. Can I have the name of your grandpa?
His name is Gerald.
Gerald. Okay, so now tell me if some of your brothers or sister experience some of the symptoms. Maybe even your father or your mother. Do they experience any nervousness problems?
My mother does sometimes.
Your mother. Depression?
No.
Hyperactivity?
I'd
like
say
ADHD?
my 9-year-old brother.
Your brother. Are they any one of them under psychiatric medication or counseling?
No.
Have any of them have attempted a suicide attempt?
No.
Dead of suicide or drinking problems?
No.
Let me see what else do we have here, Ashley, for you, so you can give me more information. Have you ever been considered to have hyperactivity or ADHD in school?
No, I'm usually quiet.
You're quiet.
Reserved.
You're reserved, but you're also a straight A student, right?
Yes.
That's
I
good qualities.
try to get myself involved, but not too much.
Not too much, okay. Are you doing any sports?
No. I used to do soccer, but I dropped out.
You dropped out, okay. May I know why you said that you dropped out of soccer?
I couldn't handle all the team stuff and how they were probably dependent on me, but I couldn't handle it.
No, you couldn't handle it. It was too much stress. Wow, I can understand how that make you feel, Ashley. You know that it is very common seeing, especially with teenagers, it is very common to see that they experience some sort of anxiety and shyness of some sort. Let me see if I have any other question here before I let you go, Ashley. Have you ever been arrested?
I haven't.
Do you have any religion affiliation?
Not really. We're not really religious.
No religions? Okay. Any other social activity that you participate in?
I used to. Well, it's not really important, so not really. But it was when I was younger.
When you were young? What happened?
I was in a ballet class.
Ballet class? Oh, how fun.
It was super exciting, but
it was super exciting.
Once I got older, I got nervous and I couldn't do it. They asked us to reform and.
Oh, I can see how much the symptoms of feeling nervous and anxiety have interrupted somehow, interfere in your life. So you said that you stopped dancing, that was ballet, and you were also doing soccer, and you have to drop off from both activities due to your feeling shy. Yeah, well, thank you for sharing that. And I'm very happy to know that you're actually taking action, so you can see some changes in your life, right? Okay. Thank you for sharing that. So tell me, every time that you were experiencing shyness and feeling nervous, who do you turn to ask for help or maybe share about how you feel?
Sometimes I'll talk to my brother or my mom.
Talk to brother and mom? Have you ever been verbally abused?
No, I haven't.
Emotionally abused?
No.
Physically abused?
No.
Sexually abused? Have I neglected?
No.
Thank you for sharing that. Do you drink any alcohol?
No, I don't.
Have you ever used any drugs?
No.
Marijuana?
I do occasionally.
Occasionally, okay. So what do you mean by occasionally?
Every time I get too anxious,
Thank you for sharing that. So every time that you get too anxious, marijuana is get to. When is the last time that you used marijuana?
3 days ago.
3 days ago. Cocaine?
No.
Crack?
No.
Heroin?
No.
Methamphetamine?
No.
Ecstasy?
No.
No. Is there anything else that you would like to share that you consider to be important for me to know and for us to start therapy?
When I was In elementary school, I was bullied.
You were bullied, like him? Where else?
Um, like
You said that it was when you were in elementary school, right?
yes.
Mm-hmm. Can you tell me more?
And I was really shy too back then, but not as much.
Mm-hmm.
But as soon as I got to high school, I feared that people would continue bullying, so I just
Oh, okay. So you say that you get bullied when you were in elementary school.
yes.
Would you like to expand a little bit about exactly how bullying looks like to you? How was your
Um,
experience?
I every time I would say something, I would sometimes stutter, and people would make fun of me.
Stutter and other students will make fun of you. All right, that is excellent. Actually, I really appreciate you opening up about sharing about the problems that you have, and we'll do our best to help you overcome those feelings, and you can live a normal life as much as possible. So you don't have to actually get out of some physical activities. So those are fun activities that you can continue to enjoy, especially at your age. So thank you, Ashley, and we'll see you soon.
Okay, thank you.
Have a wonderful day.
You too.
We'll contact you soon. Thank you.